welcome to today's session. I'm so glad you could join me this morning. I know it's a full agenda for you all. Today, since it's such a small group, I'd like to keep our session interactive. So if at any point you have questions or need further clarification on anything, please just let me know. So our agenda for today, I will be sharing with you a little bit more about Mourinho Chappelle. We're going to be exploring the online learner population, and it's really the research behind our services. I'll be sharing with you what our student support program really is, the overview of it, and then my favorite part, program utilization and case studies. We're going to reveal some data. So about Mourinho Chappelle, we are a 50-year-old publicly traded organization in Canada. We actually have a global headquarters in Toronto and a U.S. headquarters in Atlanta, Georgia, with multiple hubs across the world. We are the world's leading provider of global counseling services and have been doing so over 25 years. And we support over 25 million lives, if you can imagine that. So I know that number sounds really large, but just to give you some background, we started in the employee assistance space, so providing mental health services to corporate organizations. So companies like GM, AT&T, Oracle, and we just recently acquired Fox Entertainment. So we provide expatriate and localized support in over 200 languages in over 170 countries around the world. We recently acquired another organization which really expands our network and provides us access to care access centers in China, Russia, Brazil, just to name a few other locations. And we're currently providing student support to over 80 institutions across North America. And just to give you an example of who we work with, institutions like Michigan State, UCLA, University of Denver, and we will soon be onboarding NYU probably in the next week or so. So the online learners, they are a growing population. According to the Digital Learning Compass Distance Enrollment Report from 2017, we learned that there are over 6 million students studying in online as an online learners in higher education. 3.9% of them, or in 2015, there was about a 3.9% increase in enrollment. And just to give you an idea, these are statistics from 2015 that they reported from. 2.9% are enrolled in full-time course load, whereas 3.1 million students are taking at least one distance education course. So that means 1 in 4 students are taking at least one distance education course. Public institutions account for about 67.8% of this online population. 55% are taking online classes in-state, 40.2% are out-of-state, and 3% are unknown. The unknown, they're not properly documented, but we do know about 1% of these students are international students. And this shows you, the last statistic shows you that enrollment dropped by about 1 million for students studying in the classroom.
Wow.
So unique populations equal unique challenges. These are factors that really can lead to increased risk of developing mental health issues. So distance education by design is really mass learning by students who may be scattered across the globe, taking classes at different times of the day, and really very diverse population. So as you can imagine, there's diverse demographics of ages, nationalities, ethnicities, and language capabilities. These individuals are different. They're different. Professional experiences, educational backgrounds are different. They also have varying levels of professional and personal responsibilities, and there are disparities in resources and computer literacy. So some of the challenges which are most common include differences in learning styles and objectives, adaptability and adjustment to different learning environments, feelings of isolation due to connectivity to campus and interpersonal interactions, and an imbalance of resources and support services. So I'm sure in your classrooms you're seeing something very similar. So these are some of the mental health trends that clinicians are sharing. This study actually is from the Center for Collegiate Mental Health. And to give you an idea, this is their 2017 annual report representing data by 147 colleges and universities, reported by over 3,592 clinicians, and involves about 161,014 students. The data does not really distinguish who the distance learners are in this population, but they're definitely incorporated into these figures. So the number of clients that clinicians saw in 2017, 161,014 students. Compared to the statistics in 2011, if you can imagine, there were 82,611 students. So this population doubled in just about 6 years.
When you say clinicians, you mean people associated to universities who are reporting to the study, so that doesn't include people who are seeing clinicians outside of the university?
Correct. This is just within higher education. It's even higher than that. So those that sought out sources in their communities and so forth, that's not included in the statistic. So the demographics, these were self-reported as well. 63.7% were females, 34.5% were males, and 1.8% were other. So other means they just didn't identify or they were considered transgender. 67.2% were Caucasian, 9.3% were African American, 8.4% were Hispanic, 8% Asian, and 4.9% were multiracial. 94% of the students were U.S. residents, and 5.8% were international students. Top 5 countries represented were China, India, Mexico, Korea, and Canada. 84.9% were undergraduate students, and 13.8% were graduate and professional studies students. And the reason I included the live off-campus statistic, because this was the largest population. So 58.6% students were living off campus. 9.5% reported that they were living with a spouse. 2.2% reported they were living with children. And then top 5 presenting concerns: anxiety, that was 62% of the population. Depression, 49% of the population. Stress, 45%. Family, 30%. And academics, 26% of the population. 34% of this population seriously considered suicide. And in 2011, since 2011, that statistic grew by about 10%, and that's in a matter of 6 years. So one interesting fact that I pulled from the World Health Organization, which is not up here, but World Health Organization reports that 35 to 85% of people with mental health disorders don't seek assistance at all. So these are the individuals who are not in the community seeking help. They just live day to day with some of their challenges. Yes?
Was the 34% that's just from the ones that were seeking help, not from the general? Thank you.
Emotional and psychological distress that we see surfacing. So it's coming out in social and generalized anxiety, eating concerns, stress, academic challenges, depression, sleep disorders, and substance abuse. This is what we're seeing through Mourinho-Chappelle. And research shows that due to the extreme diversity of online student populations, there were numerous reasons cited for distress, like quality of life, changes to quality of life, personal and professional responsibilities, and where the students were in their academic careers. So to give you an example, a nursing student may have shared with us that it was quite more challenging for them in their third and fourth year of studies. So research shows that distance learners may not have access to counseling or psychological services. They may not have counseling centers that they can refer to on campus. They may not have resources in their community, depending on where they're living. We've heard back from counseling centers on campus, and there are definitely concerns there because there are jurisdictional issues that the counseling offices need to be concerned with, so delivering services cross borders may not be possible. Increasing speculation that students with mental and emotional concerns are choosing distance delivery to avoid social campus settings. There are no facts that truly indicate this is the case, but...
Sorry, can you repeat that?
Yes, so increasing speculation that students with mental and emotional concerns are choosing distance delivery to avoid social campus settings. So as I stated, there are no facts to really support this, but this is what's being reported from different campuses. And common barriers cited to the troubles that students were having were communication issues, lack of social interaction, and just having personal issues, something in life that's changed for them. And warning signs from the individuals that deal with the students on a day-to-day basis, whether it be faculty or advisors, they're noticing these warning signs through online behavior changes, their quality of work is decreasing, and the content on discussion posts seem to be a bit off. And then the lack of appropriate support services are often cited in academic withdrawal. So we're seeing that this correlates to retention and success. So this was something that was alarming to us. Technology trends, students are spending more and more time connected to their devices. So estimated time per day young adults spend connected to media. It's actually 9 to 13 hours per day. 80% of young adults report texting as their #1 form of communication. And 62% of smart users use devices to look up health conditions. So our solution is our student support program. So our student support program is a digital mental health and wellness platform accessible by mobile app, website, and telephone. Students are connected in real time with counselors who speak their language and in their cultural context. So these are master level clinicians with at least 5 years of experience. They're licensed to practice in every state and every country they operate in, and they're bound by the same professional licensure requirements and confidentiality laws. Our services are available to students 24 hours of the day by text, phone, and video, no matter where they are in the world. And we are always following institutional risk protocols as we address the students. So our student support program is accessible anytime, any place. Our process really starts with integration with the campus. We will provide an institution with a dedicated account management team. And we will also work with you to put together a customized strategy of approach. We know your institutions are all very different, so we'll work with you very closely to ensure that we're understanding your populations, who they are, where they're coming from, some of their demographics, anything that you could potentially share with us. We're gonna learn your campus culture, your processes and procedures, and we're going to identify all of your key stakeholders. So whether it be faculty, staff, student peer groups, anyone that will be able to help us reach out to the students. We provide culturally and linguistically relevant support in the host country. So this is in the United States and abroad. As I mentioned, we have over 170 countries we operate in. How many of you have online learners who are out of the United States? International students, great. And you all have students that are outside of your home institutions, out of your states as well? So the digital content is in English, Chinese, Arabic, Korean, Spanish, and French. So what I mean by digital content, so when a student has downloaded our app, a lot of the information that they can review will be in these 6 different languages. Also, we have a website that they can refer to in the same 6 different languages. And then the 24/7 accessibility and real-time support is actually in 30 different languages, which means if they're calling in, we will be able to immediately put them in touch with someone within those 30 languages, common languages. And ongoing support is actually more. They'll have access to over 60 different languages. Ongoing support may be something that a student would wish to speak to somebody again and again, multiple times. And local counseling in 170 countries and over 200 languages of support, and always in English. So when a student contacts us immediately, they'll be speaking to somebody in our Care Access Center. We'll immediately assess their situation, provide them the support that they need, and then if need to, we'll refer them on to maybe someone more, a different type of professional depending on what their concerns are. And we also have a data management system. So when I talked about our integration, when we're learning about your resources, procedures, and so forth, our data management system will capture all of that information so that we can guide the students properly. And if we need to refer them back to your campus for whatever reason, we'll have that information in our systems as well. And then we provide you with student engagement trends through assessments and surveys. So this is aggregate data. We'll be able to let you know how your students are contacting us, what the general reasons are for some of the what they're presenting, and really what times of the day, male, female, gender, and some more details, but nothing very, very specific due to privacy and confidentiality laws. Any questions about that?
So do you only have to partner with universities? Like if I was a student, could I just reach out to the organization by itself? Do I have to be within the university, or do you also work with community organizations, or is it only through education campuses and stuff like that?
That's a great question. Well, both. We work with community organizations, and we really don't have the capacity to be able to let students sign on their own. So we contract out with the institutions, and we talk about the dynamics, which learners they're looking to incorporate the program. And some will choose all of their students, others will choose very specific populations. This is a good visual representation. So immediate support is by telephone, chat, app, and web. And again, guaranteed those 6 different languages. And ongoing support is by telephone and video. And this is where we incorporate all of our locations and language capabilities as well. So the key to our success really depends on these 3 elements: the implementation, integration, and communication. So integration with existing high-risk campus protocols. As I said, we will follow your processes, your procedures, and involve all of the necessary stakeholders. So this will be discussed early on, and this will continue to evolve as we learn more and more individuals need to stay connected. And then through referral processes. So this is these are the ways that faculty, staff, advisors really can engage with our program as well to ensure that the student is being supported. And a monitored referral to the student support program. So if a student is referred to us, and it's always with the student's permission, then we can actually share information back to the university about the student's condition, about follow-up care, and so forth, just to ensure that there's a continuum of care there. And then there's assisted referral process between the student support program and campus resources. So an example of this would be, let's say an advisor is talking to a student and they're just noticing something is off, their grades are declining, they're not submitting their coursework, lots of different warning signs. The advisor can actually ask the student in the moment if it would be okay for Mourinho Chappelle to contact them directly. And if they approve, then we will conduct a wellness check-in for the student. So we will do the outreach as well if you find a student's in need. Best case scenarios, they can contact us directly right after the conversation, but if there's some hesitancy, but you still get the student's permission, we will be happy to make that call.
Is this done at the university level? I mean, who decides? Do you need Rutgers University central administration to, or people expecting their departments to do it? I mean, what's the model? That's a great question too, and it's so different from campus to campus. The university ultimately decides what the communication process is going to be, but I have not seen one university indicate that a faculty member who has direct access to their student or an advisor who has direct access to their student not be able to utilize our service in the form of these referrals. Right, but I mean, the university has to pay for this, correct?
That's correct.
Right, so, I mean, is anybody here an administrator at Rutgers?
I am.
I mean, is this the kind of thing you can imagine? I mean, is it that some central unit at Rutgers is going to decide the entire university has access to this? Or how does it get implemented?
Well, I can tell you that just because we're in discussions with Rutgers right now.
Oh, okay.
Again,
Oh, so there is a
person.
I see.
We're in the process. I mean, it's still in the early stages, but yes, we've gathered multiple stakeholders from Rutgers, involved your counseling office because there's got to be complete buy-in to this as well from them, and it's really now being negotiated across departments.
So would it be available at all the different health centers? Is that, because we have several on campus, and so, okay, I get it.
That's the hope, right?
Okay,
And
I get it.
That's definitely the hope. And maybe Anthony has.
It's not all of our students are located close to our care centers, right? So as the university starts servicing students in California or Afghanistan or what have you, they're separated from our core services. So I don't think this is going to be a replacement of core services, but
Yeah.
allow us to extend the communication to students who are not local.
So I have a degree program that's partially online, partially in person, and then there's separate tracks. And our population of students is about 40% have indicated a psychiatric disability or a substance use disorder because we are a mental health counseling program. So that's typical to see higher rates among those kinds of academic programs. And for us, we used to have in the School of Health Professions, which I don't know if you've even gotten to yet. We're oftentimes like the stepsister, but in our program, in our school, we used to have a student assistance facilitator, which was unfortunately only on campus based. And those SAFs would handle mental health crisis, substance use disorder treatment, referrals to community services, et cetera, and that got cut. And we've seen a significant loss in that service because there is no one available anymore to do that. So we become de facto case managers for our students now. And as a program director, I have to handle the requested faculty. Where do I send this person? What's our policy? The person is high in class. This individual was hospitalized for schizophrenia a week ago and is back in the classroom. So it's a very complex set of situations that I think. How does that integrate with what you all do? So if this person is presenting in a certain way in the classroom, how do I advise my faculty that I supervise to utilize a service like this?
So part of our implementation plan is to get in front of faculty members as well and the advisors. So really, we have the opportunity to gather together, to explain our services, to ensure that they know how to access us and when to access us. But this obviously, there are also some limitations to what we can do and where we refer on to professional services. But we can certainly triage a lot of the initial issues that come through.
If the student's already connected.
If the student is already connected, or if we have something that's giving the student that's allowing the student, they've signed off on a Rutgers document that says that we can contact them as well, conducting our own check-ins. Yes.
I have a question about Title IX. Do you see a lot of Title IX issues, or do they come up?
They do.
How does that get reported back?
Immediately, actually. That's when privacy, confidentiality, we let them know in the beginning. If it's something affecting Title IX, if it's a crisis situation, then we report immediately.
Because I feel like almost anything that I would refer to this, we just have a lot of Title IX issues that come up. So
Absolutely. And that will be communicated back right away in the proper channels to whomever needs to know, whoever's typically on that Title IX team. Absolutely. But our goal really is to implement this program so that students are using it in initial phases of distress. Obviously we're going to get those crisis calls, and we have a full crisis support team that's ready to respond. But we really are trying to figure out and work with you, and each campus is different. That's why I say figure out. Once we learn your systems, where the students are, how to connect them through your databases and your internal communication paths to students, introducing this service as just a support service, not necessarily a mental health service. We really want to address some of the challenges they're having, lower level challenges from the beginning. So
They're on-campus counseling center?
they absolutely are, but we'll be their first point of contact. So their counseling office is overburdened.
Okay.
So really what we're doing is anyone who is, all the students will have access to our services from the beginning, but also NYU counseling office will be triaging to us to have those initial discussions with the student. And then if we need to report back and schedule face-to-face visit for them, we'll be doing that.
So is there a continuity in terms of the person that someone is seeing?
Yes. Yeah.
I could see where when you talk about, Rutgers has this, and I'm not from Rutgers, has this, the face-to-face component where they can go. But, you know, with so much stigma around mental health issues, and then people being busy and already stressed, I could see where they too would want, even if they're a more traditional student, want the opportunity to access this in this way versus having, you know, it doesn't mean they won't go in eventually to the mental health center, but.
Yeah, I mean, it's truly just meeting the student where they are, you know, with their use of technology as well. So, absolutely. I mean, we are not discouraging in-person visits. That this is just a supplement to, and whatever we can do to ensure the students are being seen faster, because statistically, you know, some campuses have 3, 4, 5, 6 week wait time to see a counselor, you know, just because they're inundated. So, Mourinho Chappelle data, student support trends. So this is really going to show you how our services are being utilized. So this is a population, a sample population of 42 of our institutions, and this data was collected from August 2017 to November 2017. And you can see their top presenting issues. So we're seeing stress, we're seeing anxiety, depression, social isolation, cross-cultural issues, relationship issues, and then 5% cases of suicidal ideation.
Did they ask about substance use on that survey?
They do.
And no one reported that?
Oh, sorry.
Nobody
We're
was
doing about
Yeah.
and we will ask.
Self-perception.
Some more data here. Some of the preferred languages. They requested for telephone support. Majority of our students are asking to speak to an English-speaking counselor. And then it goes from there. Mandarin, Korean, Cantonese, Arabic, Spanish, and French. The time of day, most accessed our services, 42% during office hours, and then 58% non-office hours. So we have literally had students contact us in the middle of taking a test. They were so stressed out. They just needed someone to talk to for the moment. And support provided as percentage of total cases. So 53% are ongoing cases. So this is the continuum of care. They're going to be having the same counselor they speak to on and on. 27% were telephone support, and 19% through chat, through text. So, program engagement case study. This is a case study from one of our partner institutions. We get asked, well, how are we going to know if the students are going to access our services? I can tell you this was a properly implemented program with one of our partner institutions. Their annual program engagement is 30%. So 30% of their student population is using our services. And this is quite high, because usually if you ask a counseling office how many students are coming in, it could be anywhere from 5 to 11% are seeing other students. The support methods used, 33% chat, 67% telephone. You can see the digital language engagement spread, and then key findings. 70% were weekends and nighttime and weekends. So when the students have more time to themselves to think about things, that's when they're contacting us. And then 63% would not have reached out in any other way. It's part of our survey, part of our questions that we asked. So that means 63% would not have sought out treatment at all. So we are conducting an online learner research study. So starting September 1st, 2018, we'll be conducting a research project on the efficacy of our student support program while evaluating the impact it has on distance education, student mental health, success, and retention. Interested parties must enroll in the student support program for the entire academic year with no commitment to use this program further, but we certainly wish you do. And institutions will receive a detailed report on program engagement, outcomes, and we'll be benchmarking these results against other institutions that are in the survey or in the study. And then this is a full service program. We would implement just as we do typically and provide all of the resources that we have. And just a summary of the student support program, available in 170 countries and over 200 languages of support, 24-hour, and I say real-time accessibility. They will speak to someone guaranteed immediately. And then, of course, most importantly, it integrates into your existing campus resources. We really want to become an extension of your support services on campus. We don't want to be seen as a third party. This is really working together very collaboratively to ensure that we're meeting your needs specifically for your campus. And thank you.